Welcome back, Dr. Leck and Dr. Gleason, and thank you for being here for another episode of this multi-part series, Improving the Continuum of Care. Previously, we discussed how total practice efficiency and an enhanced patient experience can provide us better patient outcomes and a provider experience. Today, we will dive deeper and explore how you use the ZEISS Retina workflow in your total practice. So let's jump right in. Question number one I have for you, and I'll start with you, Erin, is tell us about your current workflow and how it allows you to maintain an efficient, high volume practice.
Well, I would say first off that at the heart of our workflow is ZEISS Forum. And that wasn't always the case. We began by investing in boxes, but what's become key to connecting those boxes has been having a way in which we can take the diagnostic imaging and diagnostic data and sync it both to the past as well as to what we want to do in the future and to different modalities, whether it be OCT, if we're talking about ultra wide field or wide field imaging, OCT angiography, visual field analysis, and the like. When it comes to retina specifically, we've come to depend very heavily on things like in the retina workplace, macular thickness analysis, advanced RPE analysis for our AMD patients, looking at angio workplaces and being able to compare angios over time. So those have been really fundamental to us and creating efficiency within the practice.
Sarah, how about you? I mean, I know you work in a different setting, but what's been interesting, I think, as we've been talking to each other, is that your life and your setting is a lot just like ours in private practice. So tell us a little bit more about how your current workflow, what it looks like, and how it allows you to maintain an efficient, high volume practice.
Yeah, similar to before, it's very similar to Erin. So we also have Forum. I've been fortunate enough to have Forum the entire time I've worked at SUNY. We got it just before I started here, and it really allows us to integrate every type of imaging that we do. Specifically in the retina service, we use the same exact workplace things as Erin, and it really allows us to take care of our patients in a more dynamic way. And working with interns, educating residents, doing so much education while we're taking care of patients, that takes a lot of time. And so being able to have the system integrated with all of our imaging modalities really helps our workflow move throughout the day.
So you both talked a little bit about this already, but I want to see if there's anything we left out. What ZEISS products do you depend on? And I love that word, depend on. And as I think about it myself, I kind of think about what do I feel like I couldn't live without? So you can answer it one of, or both, or either way. And then how has ZEISS technology changed the way you practice today? So let's start with you again, Erin.
Well, from a technology standpoint, I feel like I couldn't live with any of the boxes that I've got in the clinic, and that's just because it's become so integrated. Granted, right, if I walked into a village in India or Central America and I was doing care for impoverished folks, you're not going to have those same tools. But when you do have access to those pieces, we depend heavily on ZEISS technology. We depend heavily on the Claris. We've got an IOL master of a 500 that's in the clinic that we find is indispensable for our management of myopia patients as well as cataract patients. We're using an HFA and the various versions of HFA, as well as integrating into Forum technologies like Atlas and stuff like that. So, but on a day-to-day basis, to answer that question most specifically, we really rely heavily on ZEISS and we rely heavily on Claris on every single patient that we see.
And Sarah, I know that we talked a little bit, you mentioned earlier how ZEISS technology has really changed the flow of your practice, but let's go back again. Tell people about that one more time. So what ZEISS products do you depend on, and how has ZEISS technology changed the way you practice today in the clinic?
Yes. So very similar to Erin. So we rely very heavily, probably most heavily, I will say, on ZEISS OCT. If I had to pick one image to get on a patient for the rest of my life, it would probably be a ZEISS OCT. I just think that it gives you so much structural information that's really, really invaluable. We recently got a Claris, and the images are fantastic. I think specifically for taking care of our diabetic patients, we're able to image the posterior segment so much better and really take care of them by documenting the fundus every single visit that they come in. And Humphrey Fields, I see a lot of glaucoma patients as well. So those are the three main things that we use. And then again, I work elsewhere and I have access to those things, but being able to integrate all of it into Forum, I think that's what really has changed the way that I practice more than any individual imaging modality.
Absolutely. To be able to look at everything side by side. And like I've heard you say before, Sarah, to be able to dive in and actually look at it in a better way. It's incredible. I can't even imagine. Aaron said something earlier about the fact that there was a time when we were using scrolls to look at our visual fields.
Mm-hmm.
I can't even imagine having come this far in this short a period of time. But let's go to the difficult part, because this is what I think everybody's saying. Okay, I have this amazing technology. I have Forum, but now I'm struggling because I have to hire new people all the time in the practice. So how do you prepare staff to have these tools and resources that they need? And I guess prepare is the word I'm using, but maybe even train them so that you can provide the best patient experience. Sarah, I'll start with you.
Yeah, so I'm not directly involved in training staff, but I can speak to kind of training doctors how to use Forum. So what we've done is I've actually put on some Forum workshops. So I've done this for students, I've done it for residents, and I've done it for my fellow faculty members. Those that don't maybe work in the disease service as frequently or at all, those that want to order images but don't really want to manage the conditions and want to refer them but still want to be able to view them. I try to encourage every single person, if you want to view one image, open it up in Forum. It's just going to make your life easier, and you can do a dynamic viewing of that image rather than a static viewing of that image. So we'll do like a recorded screen shared workshop, clicking through the different workplaces, clicking through how to navigate from kind of a pathology standpoint in terms of just obtaining and viewing the images to a much higher level, really dynamically viewing, looking at the macular change analysis, looking at the advanced RPE analysis, and kind of catering it to your specialty and your needs.
That's great. Aaron, how about you? How do you train? And I love that we talked about the doctors as well. I would imagine that same process would work with staff, but what are you doing specifically to prepare staff to have the tools and resources they need to provide the best patient experience?
Well, I think one of the things that I heard Dr. Gleason talking about there that I really appreciate, and I think we've seen in our clinic, is creating awareness. She was talking about the awareness with the doctors and then walking them through and training them and things like that. When we do this with our staff, helping them be aware of what technology is at their fingertips is first kind of, it just opens the door. So there's creativity and collaboration that happens next. So they develop a kind of a zest for their own learning. They want to know what's going on. Why is it that this device does that? Why is it that I would capture this image? Or how do I improve this image or that image? And when you've got it either in Forum where you can demonstrate it, or you've got a device that you know that you can create a consistent workflow or pathway, the training becomes something that is repeatable, which is one of the keys to efficiency and getting them a whole lot better. Also being able to, I think, provide them with, and I've really come to depend on this, and I think our other doctors who do some training with the staff do as well, having a set of kind of pre-programmed cases that aren't even our own. ZEISS has these cases that are a database in Forum, and they can see, okay, here's a glaucoma case. These are the scans that have been taken across it. These are the pieces of data, clinical data, that we're trying to incorporate. That's also a really effective training mechanism, because you've got something that's there, that's a go-by they can go back to while they're getting on board. And the last piece I'd leave you with is, for us, the training has had to be repeatable because, and we saw this through COVID, right, with staff and things like that, retaining good staff was hard. And when you had new staff coming in, getting them up to speed quickly with where the existing staff are is equally difficult. But when you have something that's a process that's repeatable, there's a program to it, and they've got direct visual feedback and tactile feedback with the things they're working with, ZEISS has been really supportive in the way its technologies are designed.
So Sarah, here's another question I think that is very important to all of us, and especially if you have technology like this. How do you foster or nurture relationships with optometrists and ophthalmologists in your area?
So we're really fortunate at SUNY to have ophthalmology in our building. So we'll have specialists come in, we'll have different specialists depending on the day of the week, and we work side by side with these specialists. So having this technology allows us to have higher level conversations with ophthalmologists to better take care of our patients. So for example, in a retina clinic, if we have a retinal specialist coming in doing injections for macular edema, we can better determine, is that edema getting better? Are the injections working? Does the patient need more injections? And being able to have the forum workplace open, sitting down with the retina specialist, the OD, the resident, the intern, having all of these people sitting there learning all together, it's been really, really helpful. And so we have a very, very conducive relationship with ophthalmology here.
That is amazing. Aaron, how about you? Anything different or anything to add there about fostering and nurturing relationships with optometrists and ophthalmologists in your area?
Sure. I think when it comes to optometrists in the area, most of that relationship exists with young and emerging doctors within the community. And the idea behind it is to give them access to technology while they're growing their practices that they can also then take back and incorporate into their practices. And I'll use an example of what Forum gives us as a tool in that regard. You can take a DICOM file for a patient. So when, let's say that this doctor is investing in their practice right now, and 5 to 7 years from now, they're going to invest in Forum. They're going to have other diagnostic data box, tools that they're going to be putting into their practice. They can actually take that DICOM file from that patient, plug it into their version of Forum. And so what they're investing in the patient now isn't something that we have to be territorial about, but we can be collegial about, and how do we grow those practices. So that's one element. I think on the ophthalmology end, what we've done and what we've really leaned heavily on is the ability to export reports. Exporting reports, whether it's to a glaucoma specialist or to a retinal specialist, and those are typically where our most significant referral patterns are going out to. It allows us to connect to them well, and there's a high level of trust that's kind of garnered or that we build as a result of that, because they can see the data. This isn't just a little clinical note where I type 2 sentences, but they can see the same thing that we're seeing. And so now there's not this debate back and forth of, oh, well, maybe they have that, or maybe there's some central serous there, or who knows, right? What those different pieces might be. But when that ophthalmologist can look at it and go, yes, and I wish I had that report, that would be really great if I had that report, that becomes a really important factor.
Yes, they're always very impressed when we send them images from technology that they also own. So that leads right into my next question, Sarah, for you. What is the value of using data in your practice, and how has ZEISS Forum supported you? And I know you've said a lot, we all have, about that already, but is there anything that we left out that you could add to this now?
I would just say that everything we're doing these days is data driven, and not just on our end, but on our patients' ends too. So our patients really want to know, exact numbers, exact trends. They really want this information. And so I think in terms of fostering better communication with our patients, really involving our patients in their own care by being able to give them more kind of concrete graphs and data and really showing them all of the images rather than showing them the side-by-side printouts in 6 different windows on your computer screen really allows us to perform data-driven exams, but also lets our patients know that we're performing data-driven exams, lets them really participate in their care and be more on top of their own treatment and management plan, which leads to better outcomes.
Absolutely. Aaron, what about you? What is the value of using data in your practice? You sort of told us, but anything we left out about that and how Forum has supported you?
I think the other thing I appreciate, and this wasn't the initial design, but it's something that we utilize the workplaces for, is the workplaces act as almost a storyboard, both a current storyboard and a future storyboard for the patient. And that the way in which it unlocks the data to make the data act something that the patient can actually take action on and look at. If they're a diabetic, if they're a macular degen patient, if they're a glaucoma patient, if they've got some other retinal pathology, they can look at it and say, what do I do about that? It's not just an image, but they see change. How do I address that? And so now they're invested in their care, and the little tools that we have to show when a therapy or a surgery or a procedure or some change was made, and the patient can see that, well, we took that graph and the slope was negative, and we took that and we leveled off that slope, or we made it to an adjustable or something that we would all be comfortable with having, the patient goes, aha. And now they can continue to stay with their care over a long period of time, which is something we've never had before because they could never visualize what was happening, except for that they couldn't see, which is a horrible way to have feedback because it's debilitating. And this way, it's a positive outlook, like I'm making a difference in my life.
I think that's what I love about both of you is that not only do you have the knowledge to be able to have this conversation with us and tell us how this works in both of your settings, but you care so much about your patients that you look at technology as a way to make their life better and improve outcomes. So I just want to tell you both, it's been an honor and a privilege to spend this time with you. Thank you so much.
Thank you.
Yeah, so thank you, all of you too, for listening to us. I think you can tell how impressive Dr. Gleason and Dr. Leck are. I've had a chance to work with them, and it's just everything I do and hear from you. I've learned something even today, so I appreciate your time. I know everybody else does. And I think really what we've learned is how developing a total practice workflow really supports that patient experience, the provider experience, and then in the end improves patient outcomes.